Hello, my name is Michelle Anduele, and I'm the Senior Director for Health Promotion and Quality of Life Strategies with the Arthritis Foundation. It is my pleasure to speak with Dr. Ann Fitzcharles. Dr. Fitzcharles is an Associate Professor of Medicine in the Division of Rheumatology at McGill University and has been a consultant rheumatologist at Montreal General Hospital's McGill Pain Center for the past 5 years. He studies chronic pain in rheumatoid arthritis, fibromyalgia, and osteoarthritis, as well as the use of complementary therapies in rheumatic diseases. Dr. Fitzcharles is one of the leading experts on the use of medical cannabis in chronic pain. Welcome, Dr. Fitzcharles.
Hello, Michelle, and thank you so much for the invitation. It's a pleasure to be with you.
Thank you. So let's start off, Dr. Fitzcharles, talking about terms. The term medical cannabis, medical marijuana, and CBD are used interchangeably, but that's not correct, is it?
You're absolutely right. So let's start off. Cannabis is derived from the plant, Cannabis sativa. That's a species. And the plant itself contains lots of molecules. It's called the plant of 1,000 molecules. And amongst these molecules are those that are called cannabinoids, and they're also non-cannabinoids. And the two cannabinoid molecules that have been of great interest to us are THC and CBD. The difference between these two molecules, in very simple terms, is that THC probably has some effect on pain, on sleep promotion, and even on mood, but it has that negative effect for our patients. It causes psychoactive effects. And what are psychoactive? These are the effects that cause you to have difficulty concentrating, just not feeling right in your brain, feeling really foggy. But it's also the effect that recreational users seek. Whereas CBD has almost no psychoactive effects. So that is why CBD has got great interest and great attraction for us. Now, in the recreational world, people talk about marijuana. But when we in the medical world, I think we should use the terminology medical cannabis. So let's talk about medical cannabis, and the subsection of that is CBD.
Excellent, great. That is such a really interesting clarification. So let's talk about evidence. We know that, as you have shared in other Arthritis Foundation webinars, there's not a lot of evidence for the effectiveness for patients, but there is some evidence. There have been both animal and probably very limited human studies. So let's talk about the 3 symptoms that are of most interest to our patients: pain and inflammation as one, sleep as the next, and anxiety as the third. So could you share with us, for each of those categories, what is your perspective on where we are with regard to evidence?
So you hit it spot on. We have a lot of preclinical evidence. So preclinical evidence is evidence that we get from studies in the laboratory, evidence on looking how different cells respond, how animal models respond. And the preclinical evidence is very compelling for effect on pain, inflammation, sleep, and even those poor little animals that are anxious. So it's good preclinical evidence, but you cannot always translate the preclinical evidence into the clinical context. And as you've noted, unfortunately, we have very, very limited good quality studies. And in medicine, we look to randomized controlled trials, RCTs, as ways for us to understand whether a product is really and truly working. We really have very, very little of that in the human world regarding CBD. So we've really had to change our mechanism of trying to understand whether this product does work. And we're now spending a lot of time and a lot of effort in trying to understand epidemiological studies. So that means, what are patients using? What is their report of effect? And trying to get information in a slightly different way.
So I'm glad you started talking about the real world experience, because you're a practicing rheumatologist. And I can imagine the first time a patient came to you and said, Dr. Fitzcharles, I'm really interested in some alternative, some complement to my normal disease management regimen for my pain symptoms. So let's talk a little bit about that conversation. What advice or what guidance are you giving patients who are coming into your practice and asking about CBD for their safety?
So to start off with, as a physician, I am always delighted when a patient wants to open up that dialogue with me, because that really suggests and that indicates that we have a very good, trusting patient-doctor relationship. And I think every physician should be very grateful and gracious when a patient brings to the table perhaps a treatment intervention that they might have explored or would like to explore that perhaps has not been suggested by the physician. So the first thing is, I'm delighted when a patient wants to open this dialogue. Number two, I think that physicians have got to get themselves as best educated as possible so that we can really advise our patients in the best way regarding the current state of a product, the evidence thereof, and really fitting it into the particular person's context, because we're all individuals. And when we speak about CBD, it is clearly not a treatment for everyone, and it's not going to be a treatment that is going to work for everyone. We have some patients that say it has made a huge difference, a huge impact upon their well-being. There are other people that say it's done nothing other than burn a hole in their pocket because it is quite costly. And we have had patients absolutely that have side effects.
Okay, so let's talk about kind of the different modes, because as you know, there are patients who are considering it or who unfortunately may not be talking to their doctors about it. And so do you have any guidance for them in terms of safety when we're thinking of an oral product, a topical product, maybe an inhalation product? Any guidance for patients as they're exploring this information and doing their own research?
Right. So let's start off with the one way that we really, as rheumatologists, like to say no, and that is inhalation. We have a lot of evidence that inhalation, particularly for cigarettes, has a negative effect on inflammatory rheumatic disease and actually also pain. So our first statement is, please don't smoke. Number two, what about vaping? And we also have some concerns about vaping because there have been situations where patients have developed severe lung disease related probably to contaminants that are present in the vaping products. So ideally, don't inhale. But let me let you know that if you do inhale, the effect is much faster than if you take a product by mouth. So if you inhale a product, which we don't want you to do, you're likely to have an effect within 10 to 20 minutes. What we would like our patients to do is to take the product by mouth, either as an oil preparation or sometimes in capsules. And at least if it's by mouth, you're able to know the exact number of milligrams that you're taking, and it'll give us some idea. And I really encourage the public and patients to treat CBD as they would treat any other drug. They should know the number of milligrams that they are using. Number three, what about topical agents? And this is something that is very, very attractive to patients who have arthritic complaints, because topical agents really are not going to have the side effects of oral agents or smoking. But we have a little concern because the cannabinoids are what we call lipophilic substances, which means that they only penetrate the very, very top surfaces of our skin. So an oily substance doesn't go all the way down, and it has to be carried in a carrier to allow it to penetrate right down into the joint. And we really don't know whether the products that are currently on the market are produced in such a way that they've got this carrier going down to the joint. But anecdotally, many patients say that they do rub CBD, and it really does help their joints.
Okay, so I'm glad you raised that kind of quality issue, Doc, in one of your answers earlier, because as we know, this is not an FDA-approved product in the United States, and as a result, there is really no regulation of products beyond what individual states may be doing. And so there's always the issue around quality, really understanding what's in the product. Is the product even currently labeled? Because you mentioned knowing what you're taking. So is the product currently labeled? And of course, you mentioned potential for drug interactions, because we need to treat these products like medications. So share what you can around safety concerns that patients should be aware of in order to help them to be a kind of careful and informed shoppers.
Perfect. So the first thing is speak to your doctor. Let your doctor know that you're trying this. And as physicians, we always think of drug-drug interaction. And unfortunately, we have very little solid information that cannabinoids, and CBD in particular, has important, clinically significant interaction with drugs. But there is a potential, and there is a potential particularly for the anticoagulant drugs. So that is the first caution. The second caution is, if you're going to buy a product, at least buy a product from a company that has GMP. And GMP stands for Good Manufacturing Practices, which means that the product has been produced according to particular standards. The next thing is, check whether the product at least has been examined for contaminants. And we know that in studies that were done in the US, in Canada, and also in Europe, that only about 30% of the CBD products were accurately labeled. Some of them had almost no CBD, but what is more worrying is that some of the products had additions, and the additions were THC. And I've had some patients who have taken cannabidiol or CBD in a bottle and have really felt awful. And they probably were taking a product with some THC in it. So at least get a product from as reliable a producer as possible.
Thank you for that guidance, Dr. Fitzcharles. Now, as you know, there will always be doctors who, as you mentioned before, may not have enough information about medical cannabis products to feel that they can give guidance to their patients. And so these patients may feel either reticent or hesitant about even raising the issue. So as a rheumatologist, do you have any talking points that you would give to a patient that would allow them to kind of broach the conversation in a way that their doctor is more likely to have that conversation with them?
Right. And I think as a physician, we want to really understand, why would you like to try the product? What has been tried before? What has worked and what hasn't worked? What are the symptoms that you would like to be addressed? And we as physicians are doing the very best we can to educate our colleagues and healthcare professionals. The Arthritis Foundation is doing a wonderful job in helping and educating the public. And I would really strongly recommend that patients look to the information that is available on the Arthritis Foundation website, because there is very good information to help patients.
Thank you so much for that, Dr. Fitzcharles, and thank you for the role you played in helping us to put together some of that information. So as we close out this conversation, because I really feel that one of the critical takeaways is the focus on CBD products rather than THC for our audience. And so do you have like what you would have as your kind of one piece of advice you'd like to leave with arthritis patients today?
So CBD does hold promise. It does hold promise for reduction in pain, help with sleep, as well as reduction in anxiety. It is not a treatment that is going to work for everyone. And if you really would like to try it, be open with your physician. Have an open dialogue with your physician, because that's what this is. We're in this journey together.
Thank you, Dr. Fitzcharles, so much for taking the time to talk to us today and for sharing your insights around medical cannabis.